The last chapter discussed how we can select research participants for our research studies. This chapter discusses simple research designs that may potentially include the participants that we have selected. What are single subject designs? They are practice-oriented, meaning they're mostly used by social work practitioners more than by actual social workers. They can be longitudinal, which means observations conducted on a client or a group can take place over a long period of time. They can be used to test a hypothesis, evaluating the relationship between a specific intervention and the client changes, trying to rule out any other outside factors that may be responsible for those changes. They are practice-based, which means they provide continuous assessment and outcome data that can be used to monitor and change the interventions in real time. Finally, it provides accountability models. Holding ourselves and our stakeholders accountable for the work that is done is essential, but also ensuring the outcomes and the funding are being assessed continuously. Any research design is merely a plan for the entire research study from beginning to end, and tries to ask the following questions. When, over what period, should the research study be conducted? What variables need to be measured? How should the variables be measured? What other variables need to be accounted for or controlled? From whom should the data be collected? When should the data be collected? How should the data be analyzed? How should the results of the study be disseminated? Many of these questions are highly commingled, and some questions can take time, months to years, to answer. The unit of analysis. The unit of analysis simply is the thing you are studying, not necessarily a single person. If you are studying an impact group of women, the unit of analysis would be a group of women, an individual client, a family, a couple, a group, an organization, a community. All of these configurations can be incorporated into a single subject design and be the unit of analysis. So what are the requirements for a single subject design? First, you have to identify the problem to be addressed. You target the problem. A client desired outcome or a client's target problem can be feelings or knowledge levels or behaviors that the client wants to change. Sometimes many of these problems can be interrelated. It is therefore important to clearly identify and state the target problem. Here's an example. A female client wants her male partner to pay more attention to her. First, we must work with our client to define what this actually means. Is it more sexual attention? Is it more socialization attention? After discussing with your client, you both identify that a lack of socialization with common friends between your client and her male partner has led to stress in the relationship. The target problem is therefore increasing the amount of time your client and her partner spend together with friends. So the next step is selecting valid and reliable outcome measures. The target problem must be measured with valid and reliable measures. In our previous example, your client's problem can be easily observed and measured. However, what times and the durations of the time spent with friends cannot tell us our client's thoughts, feelings, attitudes, etc., and out of those interactions with friends. You may then decide to collect both quantitative data, which would be the amount of incidences and the duration of time spent with friends, and qualitative data, maybe your client's thoughts and feelings about those actual experiences. So then we must monitor the issue. In our example, your client will log each time spent with friends per week, keeping track of both the number and duration of these incidences in a logbook. Your client will also use a journal to reflect on her experiences during the time spent with friends, with her male partner. And finally, we're going to graphically display the data. The amount of interactions with friends can be plotted over time to determine if an increase has been achieved. That data can be compared to journal entries to determine the actual number of interactions that have increased the closeness of your client's feelings towards her male partner because of those interactions. This data can be used to establish a baseline or a clinical level and set goals for increasing those interactions, especially the ones that have the more positive effect. So what are some examples of exploratory designs? These are designs where little is known about the actual topic that we're going to study. To describe this slide, we will use a different example than the previous slide. A client comes to you with severe anxiety when it comes to social interactions. Before you can start a treatment, you must first establish if your client actually has a clinically significant problem. To do this, you will need to select a valid and reliable measuring instrument to measure his or her level of social anxiety. A clinical cutting score, or a score that indicates there is a problem, is obtained, and it is determined that your client has high levels of anxiety, so you decide that an intervention is the most likely course of action. Before deciding on the intervention, an exploratory design must be decided upon to ensure our client actually has anxiety, and to hold ourselves and the intervention process accountable. We have several choices of designs. A design that only requires the use to establish a baseline measure of social anxiety, then taking 3 additional measurements to truly establish a clinically significant problem. No intervention is a given unless the scores do not fall below the clinically cutting level score. A B design, no baseline is established for the client, probably because the symptoms are very severe and an intervention is started right away. The expectation is the scores for your client will decrease as the duration of the intervention increases. An A-B design, a baseline score is established for your client at A. The score is used to determine the type and duration of treatment or intervention, and the data is collected to determine the effectiveness. That would be part B. A BB1 design, your client is evaluated while the intervention or treatment is taking place. The scores indicated some change in levels, but the scores have yet to fall low enough to be clinically significant. Based on the data you've collected, you decide to modify the intervention or treatment to better fit your client's needs. That would be considered B1. Then you continue the collection of data to see how the intervention is working. A BC design. The first intervention is taking place, or B. You decide with your client that the intervention is not successful, so you stop the original intervention, or B, and start a new intervention or treatment, which would be C, and continue collecting the data. That is a BC design. Take a look at this graph that's comparing Bob's reading fluency as measured by words per minute over time. It looks like through the month of September. What kind of design do you think this is? If you said A-B design, you're correct. As you notice, a baseline was established from September 10th to September 21st. After the 21st, an intervention was introduced, and that data was continued to be collected at B. So this would be considered an A-B design. An A-B-C design, A would be the baseline, which is established for 3 to 7 data collection points prior to starting an intervention. The intervention or treatment is B. Let's say it started with some poor results. The intervention was then stopped, and a new intervention is started at C. And then once again, the data collection resumes. That's an ABC design. So what's an ABCD design? Baseline data is collected at A. An intervention is started at B. The intervention is stopped, and a new intervention is started at C. That intervention is stopped, and another new intervention is started at D. So there was a baseline data collected at A, and 3 different interventions were started and at some point stopped. So let's talk about explanatory designs, which try to determine if the intervention or treatment is solely responsible for the change. In ABA and in ABAB designs, a baseline score is established for 3 to 7 data points, and an intervention or treatment is started at B. The intervention is taken away, and the baseline data is taken again to compare originally to the original A. The original intervention is started again at B, and the data collection takes place. So once again, you have a baseline at A, an intervention at B, the intervention is taken away, and a baseline is reestablished at A, and the intervention is put again at B. Pulling away the intervention and establishing a new baseline followed by the same intervention can help a social work practitioner identify if the intervention itself is causing the change or some outside factor is causing the change. So what's a BAB design? An intervention is introduced at B, and your client falls below the clinical cutting score. To determine if the intervention is the actual cause of your client improving, the intervention is taken away, and a new baseline is established, or A. If the client score gets worse, then the original intervention B is reintroduced, and the assumption can be made that the intervention must be responsible for the improvement. It just maybe needs to be continued. So in a BAB design, you have the intervention. Intervention looks like it's working, but to ensure it's the intervention that's causing the change, it's pulled away. Then you have observation without intervention, or A, and you reintroduce the intervention again, especially if you see a change between A and B. So what's a BC-BC design? An intervention is established at B, then stopped, and a new intervention is started at C. That intervention, or C intervention, is stopped, and the original intervention B is started again, followed by reintroducing the second intervention C. This type of design helps the practitioner determine which intervention or treatment is most successful. So a BC-BC design, you have two different interventions which are started and stopped in between each other to see which one is providing the best results. In this basic graph, we're looking at a number of sessions followed by a number of responses. What kind of design do you think this is? If you said an AB-AB design, you are correct. As you can see, from sessions 1 through 9, baseline data was collected. At session 11, the line indicates an intervention was introduced. Between 13 and 19, we collected data as that intervention or treatment was given. The treatment was then taken away to reestablish a baseline at 21, and then finally at 30, the same treatment was reintroduced again, and observational data was taken. This is an AB-AB design. Depending on the target problem, it may be possible to establish a baseline with previous records, such as assessments that were completed prior to the client coming to your office. The best retrospective baselines are those that do not depend on client's memory, like if you're doing analysis of depression, or analysis of eating or body composition, or issues with school attendance. A lot of this information has been previously collected before an intervention has started. So what are some concerns using single subject designs? They're pretty impractical. You're one client often, and to be able to devote that much time into it, it doesn't happen all that much. A limited scope. There's just not a lot of people it can impact. And because you have one person going through the intervention, there may be some validity issues. And because the individual focus, it's hard to generalize the results. So it's hard to conduct a lot of research on the effectiveness with just one individual. As discussed before, because you're working with one individual very closely, ethical issues should always be considered. So all social workers should follow the NASW Code of Ethics.